Okay, perfect. All right. So again, for those of you who I'm seeing again for the first time, a few of you were at the MPH core orientation. I like to be real and say that this is the first time we're doing anything like this. So I'm accounting for a few technical errors, nothing that can't be handled with a little bit of humor and a little bit of patience. So I hope you brought a lot of that with you this morning because we really want to have a great time. So again, my name is Jalen, and I am the manager for outreach and scholarships for the School of Public Health in the Office of the Dean. I use they, them pronouns, and I've been working with a great group of folks to help put this together over the last few months. So if you have any questions about anything as they pop up, please feel free to use the chat, and we will try to answer your questions as soon as possible. I know there were a little issues with the Zoom link for registration. So if you have any questions, please feel free to put those in the chat as well. So I have my screen shared and I have our agenda pulled up. So let me scroll to the bottom. And if you can't share my screen, you can also access this. It's on our website. It's sph.washington.edu/students/orientation. And in just a little bit, I'll put that in the chat as well, or one of my colleagues could do that. Excuse me. So we have a welcome and kickoff, which is me. There's a student services overview that'll come from Juanita Ricks, and then a few other introductions will be coming along the way. So without further ado, I'd really like to introduce our Dean, Hillary Godwin, so she can provide a land acknowledgement for everyone. Hillary.
Thanks, Jalen. So it is my honor to give the land acknowledgement today. Here at the University of Washington, we like to start all of our convenings with an acknowledgement of the Coast Salish people of this land, the land which touches the shared waters of the tribes and bands within the Suquamish, Duwamish, Tulalip, and Muckleshoot nations. And we do that to honor the original inhabitants of these lands, but also the people who still live here, and to thank them for allowing us to be guests upon this land and to honor our shared values with them. Thanks, Jalen.
Thanks, Hillary. So that is it for our first opening and kickoff. Now, Juanita, if you're ready, I'd like to hand it over to you.
Happy to. Any chance I could share an image?
Yeah, give me 1 second. All right, and Juanita, I think.
Awesome. This, folks, is what happens when you don't send your slides in advance. Thank you, Jalen.
No worries.
Okay, so welcome, everyone. My name is Juanita Ricks. I direct student and academic services, and I wanted to welcome you on behalf of a marvelous team of folks. You've met Jalen, and other folks don't necessarily have speaking roles today, but I want you to know that we are hard at work, behind the scenes, in front of the scenes, in support of you. And so if you were looking at that image, Jalen, Ruki, Renee, Kimberly are in the back row, and just in front of them, myself, Michelle, and Janice. We all have roles supporting students in a myriad ways. As Jalen mentioned his role, Ruki supports both EDI work in the school as well as careers and student leadership, and is hard at work right now getting our first DAX course up and off the ground. Renee really is helpful with events. She is a go-to with all sorts of information, resources, some of them in person and many, many virtual. And you can thank her if you are signing up for tutoring. She helps a lot to get all of that running. Kimberly has been a rock star as we are preparing to launch our strategic plan, a lot of which has to do with students and your experience. Michelle supports our curriculum processes, class scheduling. She's one who helped make sure that we knew whether you needed to be in person, what time your classes were meeting, and made sure that the credit lined up the way that it should on your transcript and on your degree offer. And Janice supports experiential learning. She works with the team that works with both grad and undergrad students and she is a lead specifically for the MPH practicum. So that's just a touch of our work and the faces of people who are cheering for you, are welcoming you today, are rooting you on, and are here to offer support. And I wanted to mention specifically what we are here for. We're here for resources, we're here for support, and we're here for fun. And you can find a lot of the information, because you won't meet us in person right now, on our web links. They're linked to the student orientation page, our welcome page, and they're linked to the students page, which you'll find information to access on the sidebar and also on the top navigation bar. So those were just a few things that I wanted to kind of share, because this is about resources that we have for you, and I definitely want you to know about them. But I also wanted to sort of give a more personal greeting and welcome, because you're going to hear a lot about unprecedented year, and you already know that. And you're going to hear a lot about hard times because of a pandemic, and being public health students, you know about that. You kind of had an idea that that might have something to do with your professional aspirations and goals. And thank you very much from the bottom of my heart for what you'll do. You may have heard about social movements, and those are important too, because those get to equity and the mission of public health and the mission of disparities in public health. And I thank you for that as well, in the way that it touches us all and touches me personally. But what I also wanted to say to you is that, as interesting a time as we're living in, it's so critical that you know the importance of your work, know the importance of your presence, know the importance of your community to you and to us in this time. Please reach out to us and see us as a part of your community. It may be awkward the first couple of times, because, you know, it's like, oh, I've never actually met this person, but here I am meeting this person. Well, you're meeting this person, and I will tell you that I'm like corny. So if it helps to know a little bit about me, to make that first reach, don't hesitate, because you're reaching out to Corny Juanita. I am also going to say to you that this is going to be an interesting way to start your undergrad or your grad studies. And there may be times when it leaves you wondering if you made the right choice to be here. It may leave you wondering about if you have what it takes to sustain this, even though you really want it. And I have to tell you that there is no mistake that you are here. It's really important that you hear that right up front, because as exciting as it is, it's also scary to start something new. And it's a time when a lot of people are wondering about what's coming. You're here because you're supposed to be. There were no accidents in the sort of like moment that you decided to accept an offer. There were no accidents when the faculty identified you as someone who should be in this program and should be in this field and should be advancing this field. It needs to be said right up front, because, you need to have that in your toolbox along with everything else that you have when a hard day comes, and you need to remind yourself that there are people who want you here, there are people who are rooting for you here, who want to have fun with you, who want to learn with you, who want to engage with you, and want to change the future with you. So please accept my sincere congratulations on being admitted, on choosing to start and join our community, and don't hesitate to reach out. Thanks so much for the time, and I'll cut it now.
Thank you so much, Juanita. I really appreciate that. And I'm sure everybody else here does as well. So just moving forward with our agenda, we have Will Zhang, who is a second-year EPI student, I believe. Sorry, Will, if I got that wrong. But Will is here just to talk about his role in a little bit and possibly correct his role if I got it wrong. So where are you, Will?
Hi, Jalen. No, you got it right. And thank you, Juanita, for your powerful words and your introduction. My name is Will Sang. I'm a second-year MPH student in the EPI department, and also a graduate of the public health major in UW back in 2015. So I'm here to talk about my role as a TA in the Office of the Dean to provide technical support in transitioning to remote learning for instructors and students alike. I bring experience as a teaching assistant in the public health, global health major last year, and was fortunate to be part of a passionate instruction team during the in-class instruction in the fall quarter, the wild transition to remote learning in the middle of winter quarter, and moving fully online in spring quarter. So those are the experiences I bring to this role. Now, my role is primarily to give consulting and one-on-one support to instructors in technical aspects in instructional design as they transition courses to be online. I'm also available as a resources to you all as students to troubleshoot connectivity and teaching technologies and platforms. Over half of respondents in a university-wide survey last spring quarter said that internet connectivity was one of the most prevalent technical issues. So one of the first things I'm doing, and the first announcement I'm making here, is that I will be hosting a student workshop on accessing technology and internet resources, exploring tips from the school and fellow students on connecting successfully to remote learning. It's going to be on the first Monday of this quarter on October 5th. And the Student Academic Services team will be announcing the date and the Zoom link through email shortly or soon. I also want to take this time to acknowledge that this is not a normal time. 3/4 of students in that survey cited emotional and physical burnout, and a quarter reported financial instability as issues to their learning environment. And there are definitely going to be challenges moving into this school year. And for myself, I also struggled with that decision between my first and second year, whether to put my own studies on hold so I could work and hold out until, better days. But here I am as well, going through this with all of you. And I congratulate each and every one of you on embarking on your first year in whatever program you're in. And I look forward to hearing about your successes and challenges and for us to learn together. I'm available for any questions or comments or consults at sphta@uw.edu. And hopefully that email will be available somewhat accessible for everyone. And I'll stop there. Thank you.
Thank you so much, Will. I was a little muted there. Will, I believe you're going to stick around and answer questions in the chat if you have any. Okay. And also, I want to make a plug on our resource page on the orientation page. There's a little button right here. This is UW Resources for You. And right here at the very top, it says School of Public Health Digital Resources for Students, Staff, and Faculty. If you click that, let me see if it will pop up in the way that I want it to. Yay, technology worked. So these are the resources that pop up, and Will has been so incredible to put these here in such a useful Canvas page that I've actually been using myself because, again, technology doesn't come as a first language to me. So really grateful that this is here, and hopefully others will take advantage of it as well. So Will, great work for this. Thank you so much for being such a great ally for all of us. And going back to our agenda, Hillary, would love to bring you back just to share a few words.
Thanks, Jalen. So welcome, everybody. It occurred to me as Juanita was doing her introduction that maybe I should actually explain who I am. So I'll do that. As Jalen said, I'm Hillary Godwin. I'm Dean of the School of Public Health. And by the way, I go by she, her pronouns, but also I like to say I go by Hillary. So you don't need to call me Dean Godwin or anything like that. Hillary is fine. So what's my role here at UW and in the school? So our School of Public Health has 5 different departments. They're biostats, epidemiology, environmental health, health services, and global health. And then within those, we have gazillions, literally, we have 46 different degree programs. So we have 4 different undergraduate degrees, 32 different master's degrees, and 10 different PhD programs. And so probably most of the time, you're going to get your communications from the person who's directing your program and the staff in your program. And then you're also going to get information from Juanita and her team, who run the Central Student Affairs and connect with the Student Affairs people and all those different groups. But in addition to all of those folks who are going to be part of your everyday life and support system, each department also has a department chair who's in charge of administration, not just of the programs, but also the faculty, all the research programs, making sure that the staff are happy and productive. making sure that the faculty are doing well, making sure that students are doing well, making those kind of decisions. So, and those department chairs all report up to me, and then I report up to the provost, and through the provost to the president of the university. So I sort of have oversight for the whole school and for all of you guys. So that's why our awesome student affairs people asked if I'd come and say a few words. Juanita put it perfectly in terms of, this is a year like none other. It never ceases to amaze me. Every week is full of new and usually unpleasant surprises. You know, my mantra has been, just when you think 2020 couldn't get crazier, it does. But I wanted to echo Juanita's sentiment that I am confident that we as a community are going to make it through this, as a community in general, but specifically within this school. We have just amazing faculty, staff, and students who are hugely dedicated to not just, you know, dealing with the current pandemic or preventing a future pandemic, but also with really looking at those upstream determinants of health, whether they're social or environmental. You know, every topic that's come up in the last couple of months, whether it was wildfire smoke or how racism impacts people's health, we have deep expertise in each of those areas, and look forward to sharing that expertise with you, and also hearing from you about your own lived experiences and the wisdom that you bring to the field of public health. So I also want to echo Juanita's sentiment of, we're here for you. And we also strongly encourage you to take proactive steps to take good care of yourselves this quarter and throughout the year. Just because we're online doesn't mean it's not stressful. In fact, in some ways, it's much more stressful. So, and you know, that's across the board for everyone here at the school. And so we're really working to have people connect despite that. Please take advantage of those opportunities to connect with each other and other folks across the school. You'll see opportunities to engage in school leadership activities and student leadership activities, to meet your classmates in different contexts. Please take advantage of those. Juanita made reference to DACS, which is the Dean's Advisory Council of Students. I think actually a couple of you are already signed up for that, so excited about seeing you. I just wanted to let all of you know that I do have office hours once a week. Those are Tuesdays from 12:30 to 1:30. They're specifically for students. So it's not just the DAC students. Anyone can come to those office hours. I'll put a note with the information in the chat function, but we'll also make sure that it's made available to you. And really, they're completely informal. So if you are, you know, have concerns, if you have ideas, if you would like to see change made in the school that you don't think is happening quickly enough, please do feel free to come to those, or to just shoot me an email. I'll put my email in there as well. And I want to reassure you that we take those suggestions from students very seriously. So as one concrete example of that, last spring, I received a petition from 300 of our student, staff, and faculty saying that they wanted the School of Public Health to have universal anti-racism training, and we have now adopted that. So Victoria's probably going to tell you about it in the next section, but our Equity, Diversity, and Inclusion Committee has spent the entire summer working on what that training is going to look like, and we're going to start rolling it out this fall. So we're super excited about that, and that's a great example of where, you know, demand from students and their allies has really pushed us to a better place as a school. So with that, I just want to leave you with some words from John Lewis, who sadly passed this year, but whose words bring me hope, and hopefully will provide you with some hope as well. This is from his book, Across That Bridge. He ends the book with the following: lean towards the whispers of your own heart Discover the universal truth and follow its dictates. And he continues, choose confrontation wisely, but when it is your time, don't be afraid to stand up, and speak out against injustice. And if you follow your truth down the road to peace and the affirmation of love, if you shine like a beacon for all to see, then the poetry of all the great dreamers and philosophers is yours to manifest in a nation, a world community, and a beloved community that is finally at peace with itself. I welcome you all, wish you all peace, and look forward to hearing you speak up and stand up, and hope to be standing there right with you. Thanks.
Thank you so much, Hillary. That was so powerful, and I'm really grateful for your time and your commitment to this event. And so next up, I'd like to introduce Victoria Gardner. Victoria, are you here?
Yes, I'm here. Can you hear me okay?
Yes, ma'am.
Can you see me? Hi, everybody. Good morning, good afternoon, good evening, wherever you are. My name is Victoria Gardner, and magandang umaga sa inyong lahat. I am the Assistant Dean for Equity, Diversity, and Inclusion in the School of Public Health. I go by she, they, sha pronouns. Sha is a Filipino pronoun we use for everybody, which is gender neutral. I just wanted to tell you a little bit about myself and my role here and a little bit of the work that we're doing. 10 minutes or 5 minutes is certainly not enough for me to be able to share with you the breadth and the depth of the work that is happening in the School of Public Health. So just a little bit about me. I'm Filipino, born and raised in the Philippines, and I went to school here at the UW. I did my master's in education and my doctorate in education at the UW, so I'm a Husky twice over. I have lived on the UW campus as a parent. I have been a patient at the UW hospital. I've even given birth to children in the UW hospital. So I am truly a Husky through and through. So I consider myself as someone who can speak about and critique the university in a good way because I speak about it out of love. And so when I say to my colleagues and to you all that we need to make the UW a better place, I speak about it out of love for this university from whom I have gotten and received so much learning, lifelong learning, educational, academic learning, and real life learning. So I am so grateful that you are all here. Before the School of Public Health, I was in the School of Medicine, so I have special love for students who are going into the health professions. I once had a student describe going into health professions as going into a burning barn. And right now, that sure is what it feels like, that you're running into this field, you know, when so much is happening and so many people would rather just not have to deal with it, but you're doing it. So each and every one of you gets love from me, from all of us, because of that. And just only because of that. I mean, that's a huge thing. You're doing this for us, and you're doing this for me, and you're doing this for my family and my community. So I'm so happy that you are doing this for yourself, for your family, for your community, and it's for all of us. So thank you so much. And thank you for choosing the UW to be the place where you get this education. I also want to let you know, I was gonna share my screen. I don't know if that's possible, but I think it's okay. If you go to our SPH website and you'll find the diversity webpage there. One of the things that I do is, aside from providing training and moving our school towards becoming more anti-racist or becoming more equitable. I also am the person that you can talk to if you have concerns about class, about instruction, about teachers, about faculty, about the world, heck, about anything. Right now, you know, you can contact me through my email, vg@uw.edu, or the DC info email or the bias concern link, which is right there on the right-hand side. Thank you so much, Jalen, for doing that. So yeah, you can go to this page and click on the links, and that will tell you, how do I make a complaint, or how do I share something that I'm not happy about, you know, or something that happened in class today. You know, we want to know, I want to know what happens. And what happens after that is that if it's actionable, meaning I know who the people are involved and I can do something about it, then we can address it. But if it's something that I don't know, like specifics, or you don't tell me who you are, which is okay, or it's anonymous, then I can just use it as a way to kind of inform. It keeps it on my radar so that if other concerns come up, then I'll see a pattern or a trend. So, and it can also be the focus of our training. So that's one thing that I'll say about our bias concern notification or policy. And I think Juanita will also be able to tell you more about our student concern policy. Okay, and let me just say very quickly that we, in our strategic plan, our values, we rethought our values. And this year, I think I'm very excited because our values of equity, justice, and anti-racism are super timely for where we are today. Equity, because a lot of us still need more than others in order to have an equal foothold in our health and to achieve that health excellence. Justice, because we need to transform our justice systems, whether it's the legal justice systems or it's our personal justice system of how we hold each other accountable. That's justice too, right? How we build relationships. Anti-racism, because it's not enough for us to say that we're not racist. So later on in our session, we hopefully will be able to talk more about that as we review and discuss chapter 13 of the Common Book. So we can talk more about that. Are we an anti-racist institution? No, not yet. We're not there yet. And certainly the university as a whole, we're not there yet. There's still many, many policies that uphold white supremacy in our culture, not just in this institution, but in other institutions and in broader, large segments of society, including public health. So I'm so excited that you're all here to join us for this journey, the journey of re-envisioning and reimagining public health to what it's supposed to be. You know, what is this shared anti-racist power that we can all have together as a community, as a school? I'm excited about that. And so I'm looking forward to meeting all of you and working with all of you to figure this out and to work towards this together. So again, my email is vg@uw.edu. Feel free to reach out anytime. My office hours are Thursdays from 10:30 to 12. I teach Monday afternoon and Wednesday morning. I teach MHA 511. So those of you that are in MHA program, holler. And my office hours are 10:30 to 12, and my Zoom ID is People Power, just one word. So just go ahead and, you know, put that somewhere in your, you know, I'm sure fast growing Zoom ID notebook list. So thank you, and I'll turn it over to Jalen. Thanks, Jalen.
Thank you so much, Victoria. Wow. Okay, everybody, I don't know about the rest of y'all, but I feel super empowered every time someone speaks. And I'm just like, all right, it's time to go change the world. So I really appreciate that. I think more than ever, I need that motivation and that understanding with this climate. So thank you so much, Victoria, Hillary, Juanita, everybody. So moving forward, so we're gonna have a representative from Hall Health, Safe Campus, and the Counseling Center come. But before Patricia steps up and to discuss these campus offices, I just want to preface this by saying, you know, this year, again, very unprecedented. So, you know, if you have a bingo card, mark that, unprecedented is here. It's an unprecedented year, right? And so these resources are super important about how do we access them? What does it mean this year with everything being really different? And how can you really focus on taking care of yourself? So I just wanted to preface that with that and just be thinking about, okay, how can I find my community here at UW given, you know, everything else? So without further ado, Patricia, if you're around, I'd love to hear from you.
I am here.
Yeah.
Hello. Thank you, Jalen, and thank you, everybody. It's always so great to be back with public health folks. I graduated from the School of Public Health, feels like many years ago now, but I have a lot of fond memories and always appreciate the chance to be with you all. So I'm just gonna awkwardly try to share my screen here,
Okay, all right.
if that's okay.
No worries.
And hopefully I won't reveal too much of the chaos that is my desktop to you. Let's see if I can, there we go. Avoid that. Is anybody seeing anything?
Yep, I see it.
You're seeing the slides?
I see the slide. Is there a way to get it full screen?
Okay, for some reason,
Oh, there
I'm
we go.
not. Let me see if I can figure it out.
No
All
worries.
right. Are they showing up full screen for you?
Yes, now it
Okay,
is.
great.
We got it.
Strange. Okay. So my name is Patricia Atwater, and I work at Hall Health Center, which is, you know, sort of your default. We don't want to just be your default. We want to be your first choice, but your student health center. And we're located right on the middle of campus. We are open regardless of what happens. We've been open all along. And we, very importantly, are not named after a hallway. We're named after a dude whose last name was Hall. It's a very long story, but it causes a lot of confusion for students who think that we're a hall, which we have hallways. So this year, I'll just sort of preface what I'm going to say by just mentioning sort of the context for us too, that for a long time, we've known that sort of the decentralized nature of our student health services on this campus can cause some difficulty to students who are trying to navigate the healthcare system, which is already confusing enough. And so what we've tried to do increasingly is to integrate content from across student health units. And so I'm going to be talking about student health services, sort of like generally speaking, and that will represent Hall Health Center, represent the Counseling Center. Glad to talk about Live Well and disability resources for students if folks have questions. And then Safe Campus, I'll mention just a little bit. And as folks have questions, feel free to put them up in Zoom. I will be hanging around after my time is up, just to make sure any questions that remain get answered, because I don't want to, overstep my 20 minutes, as I know I'll be tempted to. We've also tried to synthesize all of the content into 5 things. This is always a challenge. What are the 5 things to know somewhat successfully? So we'll see. I like creating lists of things that helps me remember. And then the last thing that I'll say is that my experience as a public health person and a person who works adjacent to a medical and mental health clinic is that when students, when any of us really, but when students in particular are very unfamiliar with the healthcare system as it pertains to them, what we often see is that students will delay or avoid care altogether. And obviously there are so many other factors there, right? But this is one factor that we, my office in particular is here to help with. And so what I'm asking of everybody here is to take a few minutes, and I'll provide some guidance in a bit, but take a few minutes to do some planning around where you're going to go for healthcare, how to use your health insurance, do some research if you need to, so that when the time comes that you aren't feeling well or you're experiencing distress or something's going on, you're not scrambling to figure out in the middle of the quarter when things are really hectic where to go and what to do. Because we don't want you to be in that position where you are overwhelmed by the healthcare system and then putting off or avoiding care altogether. All right, first thing to know about, this is not a small thing, and it's how to access healthcare affordably. And you'll see on the bottom of our slides, there is a link to our website, and this is a shared website that we share with many other, again, student health related units. And so all of this information that I'm going to share with you today is on this website, including a great deal of information about health insurance and access to care, and including my contact information should you need help with health insurance or health insurance related stuff. So the first thing is pretty obvious, and that's that insurance is important. It's important that you have health insurance if you're eligible for it, and that you have at least a sense of how to use it. Because health insurance is really the only way to avoid having to pay the full cost of your care. When you go to the doctor, a mental health provider, vision, dental, you name it. So having an insurance card and carrying it with you at all times, just sort of generally knowing like the name of your company and where your insurance comes from, both really important. And if you don't have health insurance, either now or in the future, most students are able to get insurance through the state of Washington, through Washington Health Plan Finder, or another state health insurance marketplace if you're outside of Washington state, or even the federal marketplace if your state doesn't have its own marketplace. Oops, goodness. And I'm glad to help if you have questions about how to go about that process. Very detailed instructions, I know because I wrote them, are on our website as to how to get health insurance through the Washington state marketplace. But if you are struggling with that in another state, glad to talk to you as well. One thing that causes a lot of confusion about healthcare affordability for students, or fair amount, is sort of the difference between health insurance and your benefits as a student. And especially now, given that some students are not in the Seattle area, not near campus, and still paying the services and activities fee. So the staff fee, as you can imagine, entitles matriculated students to a variety of services and activities on campus. And this is everything from the gym, UW recreation stuff, to the Q Center or LGBTQ Center on campus. Lots and lots of different units receive this funding, and that makes their work possible. There are a few services that are subsidized by this fee, and I would call them prepaid. So if you think of them that way, it can be helpful. And I just want to mention them. So one is unlimited medical advice from a nurse 24/7. Wherever you are, our ability, just because of licensing, credentialing rules, is somewhat limited in terms of providing medical care to folks who are out of state, but we're always happy to talk to you and help you figure out what to do, even if we can't explicitly provide medical advice. So nurse advice, always free, 24 hours a day, 7 days a week. Contact information is on our website. So that it can always be a place for you to start. If you're not sure where to start, you're not sure whether you need to go to the doctor at all, or how urgent your situation is. And then really all but one of our mental health services on campus, related to campus, are prepaid. So that means short-term counseling, crisis support, and group therapy. Now, one exception is psychiatry, which we do bill health insurance for. So you have these student benefits aside from your health insurance. And your health insurance is really important because it will help cover the cost of everything else other than these two things, right? And that's essential. So aside from doing some work around health insurance and knowing kind of what's going on with your insurance or getting insurance if you don't have it, it would really benefit everyone in the world if they, in my opinion, identified healthcare providers that they could go to that were going to be affordable for them before they got sick or before things before life got very busy. And so we suggest identifying wherever you are a primary care option and an urgent care option. And what you want to do is check to see if they're contracted with your health insurance. There are also community clinics if you don't have health insurance because you're undocumented or a DACA recipient that see people on a sliding scale based on income. And those are all over the country as well. And if you're not sure where to find a list of providers that's contracted, your health insurance company's website is always the best place to start. So, related issue, where to go for care. So, you're going to be identifying primary care provider, urgent care provider. In the sort of the backdrop, Hall Health is an option for you. We're part of UW Medicine. We offer in-person and video appointments. Unfortunately, because again, of licensure rules, our providers are primarily licensed in Washington, so can provide care through video to people who are in Washington but are limited outside of Washington state. We have an in-house lab, a pharmacy, and we do offer immunizations if you haven't yet met the immunization requirement. And I was just going through a list of all the School of Public Health new students and letting folks know if they had met the requirement or not yet. So I've gotten about halfway through the list. If you haven't heard from me, you will. And then if you were interested in scheduling at Hall Health, you'll need to give us a call at least for the first time. Thereafter, you're able to schedule online through our patient portal. There are plenty of other options in the Seattle area. If it's not affordable for you to come to us because your insurance isn't contracted with us, Kaiser facilities, urgent care clinic near campus. And again, best thing to do is to check with your insurance company. So I know that time is running short, as it always does. So I'm just gonna talk about mental health and then maybe give you one more quick thing to take away. So mental health services and resources on campus have been a point of a lot of work and thought recently, and there are some changes that are going to be rolling out over the next couple of weeks. So the first is that we will now have one front door for all mental health services instead of two. We used to have two, which caused some confusion. And that's going to be the counseling center's phone number. So to schedule an appointment for questions, you can call just one number now. We also have a new partnership with a company called My SSP that offers 24/7 kind of immediate mental health support with a counselor, regardless of where you are in the world and in 7 different languages. And that information will also be on our website. Continue to offer on campus or remote in Washington State, short-term counseling and group therapy through the counseling center in addition to My SSP. So I'm just going to mention Safe Campus, and then I'll be done. So Safe Campus is a really essential resource and a phone number to put into your phone, along with the many others that you're adding, no doubt. This Safe Campus is a resource for any kind of safety concern that you might have for yourself, for a peer, for a colleague, co-worker associated with the University of Washington. And you can call anonymously and get advice and resources and a lot of support from Safe Campus, which is through our Human Resources Office. So I'll just leave it there. Thank you so much for all of your time, and I will answer. I see a question in chat that I will respond to, but feel free to post other questions. And I will also put my email in chat.
Thank you so much, Patricia, for all of that information. I know right now everything is in flux, so it's super important for you to be here and to share this information with us. But yes, folks, if you do have questions for Patricia, feel free to reach out into the chat. And she will be here, I think, maybe for the remainder of the time. I don't want to volunteer you, Patricia. But if you don't get your questions answered by Patricia, feel free to send an email my way, or just ping me in the chat, and I would be happy to follow up. Okay, so moving forward, for our last speaker before our breakout activity is going to be Erin. And so she's going to come and chat with us about the new sexual violence prevention training. And Erin, I believe you're going to share your screen if that's true. Okay, great.
Alrighty, can everyone hear me and see me?
Yes, ma'am.
Okay, great. I'm in the middle of nowhere right now, so my Wi-Fi is not reliable, so let's see how this goes. So my name is Erin. I go by she, her pronouns, and I'm also a graduate student in the Department of Epidemiology, specifically the Maternal and Child Health track. So I work in the Dean's office with sexual misconduct and gender-based misconduct prevention and response, and I also work across the health sciences schools to take a more uniform approach for students, faculty, and staff. So how this started was about 2 years ago. I developed a novel curriculum for sexual violence prevention and gave that training at my own orientation, and Victoria and Hillary made a role out of it. So when Victoria says her door is always open and wants a student involvement and equity work, it's real, it's not empty, as seen by my own role. So these workshops we've focused on faculty and staff over the past year since we gave it at last year's orientation as well. So for incoming students, we didn't really want to do it over this Zoom session since you already have a packed schedule. So there are 75-minute sessions throughout October and November that we're scheduling. So there's a sexual and gender-based misconduct webpage on the School of Public Health website, which I'll throw the link into the chat. So please sign up for one of these. It's for all SPH students, regardless of the number of credits or employment. And you'll also be receiving an email with the information, the curriculum, and the pre and post survey as well, so we can monitor effectiveness for all students. And if you're an ASC, this is different than the EPIC training. So just to highlight that. So here's some quick resources. We're not going to get deeply into things like the workshop. I would have given you a content warning for that, but just in case before then you're looking for some of those, here's a quick overview of what's offered to UW students specifically, School of Public Health students only, and then other that I think you should be aware of. I want to highlight UW counseling here. I've done a number of referrals even during quarantine and have gotten great reviews back. When they say short-term counseling, those are actually like counseling appointments for at least, like, I've heard 2 months. So it's not just like you start and then they kind of refer you out, unless you're of course out of the state of Washington. They'll help you find a provider that's affordable for you. So a great resource depending on anything that you're going through. I also want to highlight here that Victoria and myself are community resources, always here for you. Reach out anytime. On the next slide, I'll give you a more detailed overview of what services we can offer you specifically. We're hiring a counselor for School of Public Health students that's going to have time specifically dedicated to you. So that's currently in the works right now. And then the SPH bias complaint form, that goes to Victoria. And if there's a mention of sexual misconduct and you also want to reach out to me, that's completely up to you as well. Just note that if you don't put your contact information, a lot of that will just be counting in our numbers, and we can't really make any further steps from there without your explicit consent. And then, of course, Harborview Abuse and Trauma Center. One thing I want to let you know is that you don't need insurance to use their counseling services. So they will bill your insurance if you have insurance, but if you don't, they have funding sources for you to use. So they'll really work with you to make sure that you get the services you need. And they have a wide range of resources for survivors, as well as individuals who are experiencing ongoing sexual or gender-based misconduct, whether you're a UW student or not. So what can Victoria and I do for you? We're not direct reporters. The only people in the School of Public Health who are mandated to tell Title IX, which is the overarching office that handles equity complaints throughout UW, is Hillary, Dean Godwin, and Uli, who's our finance. He does a lot. Amazing person. I doubt you'd be reporting to him anyway. But those are the only people that are required to share your information with anyone or share your story with anyone. Anything you tell Victoria and I, if you don't want us to share it or push it up anywhere, that completely stays between us. So we're more of a community-based resource. So if you want to know what's available to you, or you just want to have an open and honest conversation about what's going on, reach out anytime. There's no expectations for next steps. You can just have that one conversation with us if you'd like. We can help. One thing is if you see something a faculty says in a lecture or in office hours related to sexual violence or gender-based misconduct that really doesn't sit right. For example, we had a faculty member present a case study, and a lot of the language that was used was offensive and outdated. So I had that conversation with the faculty and made sure next time there's a content warning and what language should be used. So we can also help with that stuff, and Victoria obviously can help with other equity issues related to that. So what else is happening in the School of Public Health? We have that webpage, of course, where you can register for your workshop, my contact information as well as Victoria's. You can get a full list of sexual and gender-based misconduct resources and all the reporting options available to you. There are many, so don't think it's just Title IX or the overall university one. We have some in the School of Public Health, and depending on your role in the School of Public Health, you could have special ones available to you like ASCs. And also find the latest research on sexual violence coming out of the School of Public Health. We have a state violence against womenized research group that we're currently starting, which is UW Health Sciences wide. So if you have experience with research and this is of interest to you, you can contact me and we can get you involved. And this is primarily coming out of the School of Medicine. And of course, if you want to volunteer to participate in a study of these workshops that we're doing, feel free to reach out. And then later on, if you do research on violence against women or gender-based violence of your own, please let me know so we can include it on the webpage and promote your work. And then finally, here's my email and of course, Victoria's again. So if you have any questions, you can privately message me in this Zoom chat. I'll stick around for a bit, or just feel free to email me anytime throughout the year. All right, thanks guys and Jalen.
Thanks, Erin. Thanks again for everybody sharing all of these really important and crucial resources because again, they're going to need to be utilized at some point. So with that said, let me try to reshare my screen because I've only done it a million times, so you'd think I'd be a pro at it. So now we're at the crucial point of our agenda where we get to take a break. So for 10 minutes, you get a break. So do whatever you need to do. We're trying to model this year since we are going to be, all of us, partaking in virtual learning. Breaks are crucial. Of course, there are things we could be doing, should be doing, need to be doing, but this is 10 minutes where you do nothing. So we are going to be reconvening at about, let's say 11:05. We're a little ahead. So let's say 11:05, we'll come back. Feel free to use the webpage, browse it. There are multiple resources and links here. There's a link to what dining options will be available if you are on campus. So feel free to take this time and relax. And I'll see you at 11:05.
Jalen. The book, the common book, and then there's a POC group that's going to be talking about the common book. So there's some things that watch your inbox for information on that and how to sign up and where to sign up for that. So for our activity today, we're going to be talking about chapter 13, which is space racism. This is the book How to Be an Anti-Racist by Professor Ibram X. Kendi. National Book Award-winning author of Stamped from the Beginning. Wonderful book. How many of you have read the whole book? I was going to ask you that. Use your reaction. If you can use your reaction, go ahead and put thumbs up, or just say, hey, I did it, or I'm gonna get to it. Good, that's great. I see a few. Okay, so and a wow from some of you. So for those of you who haven't read the book, that's okay. So what we're hoping to do today is we're going to divide you up into breakout groups, and I'm going to share my screen so you can see how we're going to do this. Can you see the literacy circle roles?
Yep.
Yeah, okay. So in our small group breakouts today, we would like for you to divide up into groups, and everyone in this group is going to have a role. The different roles, and you might want to take notes on this so that you have all of them.
Sorry, Victoria, there's also a PDF on our website of these as well. So yeah.
Good. So when you're in your breakout groups, you may not be able to see the screen. So I'd encourage you to just write down who the roles are, and I'll just try to go very quick so that you can get into your groups. So the first role is that of the facilitator. And this one, just make sure that everyone has had a chance to participate, to contribute, and is engaging. Summarizer is someone who provides a summary of the discussion via art, via words, some other form. The word finder finds words they did not understand and finds the definitions if they have a way to do that, or maybe others can offer definitions. The connector is someone who finds a passage or excerpt from the piece, from the book, or chapter 13 that has special relevance to you or your connection to the journey. The dreamer articulates through various means what you hope the article will challenge or inspire others to do, and the observer notices the relationships and the dynamics of the exchange of ideas. So those are 1, 2, 3, 4, 5, 6 roles. And Jalen, are we dividing them into groups of 6 or?
Around groups of 10, like 10 at the most. Yeah.
So there will be people that there's going to be 2 or three, having the same role, and that's okay. And how much time do they have again, Jalen?
They will have about 40 minutes for the group and then 10 minutes to share out.
Okay. So as you're divided out into your breakout groups, you have 40 minutes. The best thing to do would probably be to assign each other the roles. If you need to take a few minutes to get acquainted with the chapter, go for it. You can do that within the role and really exercise your particular role in the activity. What else? This literacy circle is from Paulo Freire's anti-oppression work. In that work, he tells us that we can teach each other. The oppressed have something to teach their teacher, and we have the knowledge that we need to be able to set ourselves free. That's what that book is about. So in these roles, we want to make sure that we find, a lot of times people are the only one talking or the only one who's, participating, or there's always a few consistent folks. So in this way, Paulo Freire hopes to spread the responsibility for the work across everybody. Okay. All right. So I'll stop there and go for it and enjoy. And after that, we'll ask you for your input and feedback for the share out.
Okay, so before I break everybody up into breakout rooms, just a couple of things. Try to keep track of what room number you're in. So I think it'll like say breakout room number 1 or 2. So just try to keep track, because as you are leaving and doing your thing, it won't reassign you when you come back in. So just, I don't want you to feel like you're cut off from that, okay? So I'm gonna try to get the breakout rooms going, and just give me a little bit of time. Patience and grace, y'all, patience and grace.
Thank you.
All right. So 1 second, and here we go.
I left my breakout room.
Oh, no, you're fine, Victoria. I
Okay.
told some of the staff if they didn't want to be in a room and
Yeah.
participate, then they can come back.
Yeah. Yeah.
I did too.
How you feeling? How you feeling, Jalen? How's it going?
I think it's going okay. I'm really tired because I've been so stressed out about this that now all of the adrenaline's leaving my body. And as soon
Yeah.
as soon as this is over, I'm gonna pass out.
Let's take a deep breath. Let's take a deep breath. Take a deep breath. Inhale. Hold it and exhale.
I needed that. Thank you, Victoria.
Yeah. Just need to do that. It is stressful.
Yeah.
So many young people.
They're so excited though, so I love it.
Yeah. So for the debrief, it might be good to ask, how did it feel?
Mm-hmm.
Yeah. And then
Yeah.
I'm gonna, do you want me to share my screen, or are you okay without the?
I'm okay without it. Yeah.
Okay, good. You just want to kind of let it flow. And
Yeah.
I'll let you take the lead on that, and then I'll just back you up if you need me to.
Sure, that works for me.
That works great.
Let me
Awesome.
see.
So what time are they supposed to come back? I wasn't paying attention.
I'm gonna send a broadcast message to everybody to let them know. So let me see.
11:55.
11:55. Yeah, does that sound good to you?
That's 40 minutes
Okay.
from now, or 11:50.
Yeah, we can do 11:55.
Okay.
I think that's fine.
Okay.
So that will leave them with enough time. Yeah, that's perfect.
So, some of them, it'll be their first time talking to each other and seeing each other, right? So it'll be good. It'll be good to know how the interactions went.
Yeah, I agree. Perfect, perfect. All right. I'm just waiting one more minute. I still see a few folks trickling in. All right. Okay, cool beans. So everybody, I want to bring you back and just ask you a few questions and see how you're feeling after that activity. Excuse me. And before I get started, I do want to say that it's okay to feel a billion different things. It's okay to feel like, what is the purpose of this? What am I supposed to be doing? I didn't read this book, so I'm not, whatever. As Juanita said so beautifully when everybody was gone, you're not going to be graded on the welcome. Nobody is sitting here saying like, oh, this person